Hi, this is Dr. Paul Goldberg at the Goldberg Clinic in Atlanta, Georgia. Today, we are very happy to have Lisa with us today, Lisa Cornwall. And Lisa came to us from Kansas, St. John, right? St. John, Kansas, about, it was almost a year ago, wasn't it? 1 year ago today. And Lisa, when you came to see us a year ago from St. John, Kansas, what did you come to see us about?
I had rheumatoid arthritis. I had swelling in my feet and legs and knees. I was having trouble walking. And I've had about an 80% improvement in 11 months.
Yes, and we are delighted about that. An 80% improvement in 11 months. Now, the history of this, tell us a little bit, when did your problem start? And what was the evolution of that before you came to see us?
My problem started in late 2008 to 10. I started having swelling, chronic fatigue, just wasn't really feeling the best. So I went to a rheumatologist and they said I had lupus, put me on Plaquenil. I was on that for a few years. Before that, I had chronic fatigue and they put me on thyroid medicine.
And you had been on thyroid medication, was it Synthroid?
No, I was on Armor Thyroid.
You were on Armor Thyroid, and how many years were you on Armor Thyroid for?
18.
You were on Armor Thyroid for 18 years, and were you taking any other hormones in addition to that?
I also took Bio-Identical hormones.
You were taking Bio-Identical hormones, and that was that about 15 years, or how long had you been on that?
I had been on birth control before I was on Bio-Identical hormones, so all of my reproductive life, except when I was having children, I was on hormone therapy.
Okay, so there was a considerable amount of hormone in the form of birth control pills and bioidentical hormones and thyroid hormone in the form of Armor Thyroid.
Correct.
For altogether about 20 years.
Mm-hmm.
Is that right? Okay.
Yes.
Dr. Tenner, tell us something about what your experience was in working with Lisa.
Sure. Well, after Lisa came in for her initial evaluation, we worked over email for several months. And some of the significant findings we found with her was that she had high inflammatory markers. And she also had some thyroid imbalances that showed up in her lab work. And this is one of the things Dr. Goldberg and I really talk about. And Dr. Goldberg quite a bit more than I do because he's been seeing patients for almost 40 years now, over 40 years now. And so he's seen quite a few during that time. But he has noted in particular the relationship between women who have been on various hormones, both bioidenticals and thyroid hormones, and that leading to the development or increased risk for the development of various autoimmune conditions, including rheumatoid arthritis. And I've been here working with him now for almost 10 years, and I've seen quite a few cases of that myself. And Lisa is a good example of that. So she had been on bioidenticals, but she'd also been on thyroid hormone. And in the evaluation, we noted that your thyroid levels were abnormal. Mm-hmm. Lisa had emailed me during the course of working with her, and she said she was suffering with high pulse, as I recall, mm-hmm. and some anxiety, difficulty sleeping, shortness of breath. And I informed her that all could be related to the fact that it looked like she was over-medicated in terms of the amount of hormone she was taking. So she went to see her medical physician, and I'm going to let you pick up the story from there, and what happened after that.
I went ahead and went off thyroid for a little bit, just to get my levels to come down. And when it came time to go back on thyroid, I made the choice myself that I wasn't going to. And so now I've been off of thyroid since last June. And feeling much better. I got very sick in June. I couldn't walk 100 feet, had lots of things. I was sick. I was just really sick.
And one of the important things to note is that Lisa was on thyroid medication for approximately 20 years, and she went off of it. And how long has it been you've been off of it now for?
Since last June.
Since last June. And we're now in April 2nd, 2019. And she's just recently had a thyroid profile done, and her thyroid profile came back, thank God, it came back absolutely normal. She has a normal thyroid profile. So her thyroid was able to kick back in even after that long period of time on replacement therapy, something which doesn't always happen. In our experience, it's when a woman's been on, or a man, has been on thyroid replacement therapy for more than 2, 3, 4 years, it's oftentimes very difficult to get them off of it. And in Lisa's case, she was able to get off it successfully. And one of the reasons, not only because she was very diligent, but was we were having her replace some of the foods that she was eating that weren't so healthy for her with a much better diet, including one thing that was really striking was that Lisa used to be a favorite beverage of yours was
6-a-day Diet Coke drinker.
6-a-day Diet Coke, which has aspartame in it. And aspartame really is, as far as I'm concerned, is a toxin. And when you take that much, a woman or a man takes that much, it's going to have adverse effects upon the body. And Lisa was dedicated to getting well, had the will to get well, and dropped all of those Diet Cokes in addition to making other changes in her diet. In fact, you had already started making some changes in your diet. I think even before you came to see us, she had worked with the Paddison program before she came to us. But when she came in, we tightened down the hatches a bit more. And she was still taking those Diet Cokes, unfortunately, and she was willing to get off of those. And that is a load of chemicals that was removed from her and therefore unburdened her entire body, including her glandular system and her thyroid gland.
Mm-hmm. I'd like to just add a few things. You've now had multiple thyroid panels done that
Yes.
have been normal. So not just one, but multiple thyroid panels.
Mm-hmm.
And then the second thing is Lisa's HSCRP, which is a very sensitive measure of inflammation, which is primarily how we monitor patients with rheumatoid issues, was very high initially. I believe it was about 7.5. And Lisa now has a CRP that's not just normal, but healthy. It's excellent.
Yeah.
And a SED rate, which is another marker of inflammation, that's very low. She's off prednisone, off Armor Thyroid, off methotrexate. She's doing excellent. And one other thing I want to mention about Lisa is one of the major reasons she got well is that she showed a tremendous amount of perseverance in going through some rough periods. It's taken Lisa a full year of hard work to get where she is right now. And she owes herself a lot of credit for sticking it out, working through those rough periods, which we help guide you through. And so for patients who are willing to work hard, make the changes, and then allow the time needed for the body to work through those bumps that are invariably going to occur, there's a big light at the end of the tunnel.
There is.
Yeah, Lisa truly had the will to get well, and there's almost always going to be, with any type of chronic health problem, there's going to be some, what we refer to as bumps on the journey, bumps along the way, where you're going to have some exacerbations of symptoms as the body dives in and tries to uproot disease and get itself back to a balanced state again.
Mm-hmm. All right. Well, Lisa, is there anything else you want to add?
I don't think so.
Yeah.
I'm very happy with the care I've gotten here at Goldberg Clinic.
Thank you, Lisa, and congratulations to you.
Thank you.